Thank you. Janet Finch-Saunders.
Diolch. Cabinet Secretary, less than 1% of Welsh NHS expenditure is targeted towards child and adolescent mental health services, yet 5,400 children and young people are referred to local primary mental health support services for assessment each year, with a further 2,355 waiting several months for their first outpatient appointment. Latest figures now show 73 children and adolescents are waiting 26 weeks and beyond for treatment. Now, at such an impressionable age, and when we talk about childhood experience, do you not agree with me that the earlier that we can get intervention and good treatment for our children, the greater outcomes are likely to be? So therefore, will you commit here today to working with the Cabinet Secretary for Health and Wellbeing to bring down these unacceptable waiting times?
I'm grateful that the member is now on board. I work with the Health Cabinet Secretary already, as well I do with all Cabinet colleagues, including the Education Cabinet Secretary. We must get upstream of some of these issues. I mean, we've got to tackle the here and now, and the mental health cases that you talk about, particularly young people, is one that troubles me too. But actually what we've got to do is get into the prevention end of this and making sure that the experiences of young people don't lead them into mental health trauma later on in life. So I would encourage the member in her questions in the future also to think about how do we collectively, how do we have a non-political view on how do we move resources from the critical end into the prevention end, because it is an important process of where we're going to be. There's only one pot of money, and we've got to get in early on to make sure the young people that she talks about isn't duly affected long-term in terms of adulthood.